Good afternoon. My topic is on scleral buckling surgery still holds good in pseudophakic eyes. An introduction, we know the pseudophakic RD, the incidence being 0.2 to 0.5% during first year, and it continues to rise over 1.79% at 20 years. What are the risk factors for pseudophakic RD? Myopia with axial length greater than 25 mm, disruption of the posterior capsule, intraoperative vitreous loss, incarceration of vitreous in the wound, YAG laser capsulotomy. So we know the options for pseudophakic retinal detachment, either vitrectomy, scleral buckle, or pneumoretinopexy. The main criteria which we have to keep in mind before selecting for buckling is the IOL implant with intact posterior capsule is necessary. There should not be any vitreous disturbances and minimal capsular remnants so that we have a good view of the peripheral retina. Thus, pseudophakia is not the contraindication to scleral buckling procedure. So let us know a brief about the pseudophakic RD characteristics. They are more affect the elderly population. The progression of the RD is fast because of the vitreous being syneretic and fluid. The retinal tears are smaller and multiple and more peripheral, and there will be difficulty in visualization and localization of retinal breaks because of the cortical remnants, posterior capsular opacification, and optical aberrations from the IOL. Also, we have to keep in mind the fellow eye, the incidence of tear and RD incidence is quite high, that is 10 to 40%. So analysis, we selected from 2015 to 2018 retrospective data analysis, a total of 112 eyes of RD, pseudophakic RDs, among them 40 cases underwent scleral buckling procedure with minimal follow-up of 3 months. So out of the 40 patients, 23 were males and 17 females. The mean age is 53 years. And the RD presentation varied from 3 months to 30 years, the incidence being highest, that is more than 50% of them presented between 3 to 5 years post-cataract surgery. And most of them all are macula of RD. 40% had systemic comorbidities like hypertension and hypothyroidism. 17% of the cases had difficulty in maintaining post-op positioning. For example, bronchial asthma patients and 2 patients with fracture femur, 2 cases with low IQ patients, and a case of poliomyelitis. So that is also one of the criteria which we opted for scleral buckling procedure. And the cause for RD is posterior vitreous detachment, which was seen in 92% of the cases. 2 cases had serous choroidal detachment, which were treated with systemic steroids preoperatively. 50% had subtotal RD and 30% with total RD, and majority were fresh RDs like with PVR grade B, 80%. The site and the number of the breaks, 42.5% of pseudophakic RDs had a single break, and the most common, that is 72%, were HST, and the common location being superiotemporal quadrant, that is 31 eyes. And 50% had multiple breaks, and they were lattice with holes and operculated holes. And the single quadrant buckling was performed in 60% of the patient, 28% 2 quadrant. All the cases we drained the SRF, and to prevent hypotony and if there is a break at the edge of the buckle, we opted for internal tamponade. And intra and the post-operative common complication we came across was subretinal hemorrhage at the drainage site in 3 eyes, and the most common is due to hypotony and the raised intraocular pressure post-operatively in 3 eyes. The surgical results, anatomical success is 90%, functional 52% at the end of the first week. On follow-up, improvement of vision was noted among 62% of the patients, stabilization 25% of the patients. No improvement of vision was seen in 12.5% of the cases because of epiretinal membrane formation in 3 cases and retinal redetachment in 2 cases. Thus, the discussion, the results are quite comparable with that of the vitrectomy in spite of multiple breaks, and early macular involvement is one of the known factor. And also there are studies where they have done among the mentally retarded cases, pseudophakic RD which has been done buckling procedure, they had a good results, it's been reported. Thus, to conclude, scleral buckling is still can be a good operating procedure among pseudophakic retinal detachment, depending upon the skill of the surgeon and appropriate case selection. Thank you.